Hello, my friends. Welcome to Health Focus. It is a quarterly health program sponsored by the New Jersey Conference. Today, I'm very happy to present to you the first episode of Health Focus for 2024. And I'm very delighted to have with me Dr. Alicia. She's a dentist, and I'm very happy she's with me today to present to you this program. Once again, welcome to Health Focus. Dr. Alicia, it is a pleasure to have you today.
Thank you very much, Pastor Etienne. I would like to thank New Jersey Conference and you for the opportunity you guys are giving me to address my brothers and sisters.
Yes, indeed. I think by this program, you're going to serve a lot of people in the New Jersey Conference.
Thank you. It will be my pleasure.
Dr. Alicia, as you know, dental health is very important. And how often should people change the toothbrush?
Well, ideally every 12 to 14 weeks, And whenever you see that the bristles of your toothbrush are fading away, or not even fading away, but you know really that you haven't changed it in 12 to 14 weeks, it's time to change it. It's time to change it. What happens is when the bristles fade away, you think you're brushing, but you're really not brushing. You're like my grandmother used to say, you're brushing without brushing, because the faded bristles don't really do the work of removing plaque and bacteria.
Yeah, this type of question, they look simple, but I think they're very important for the people, for the audience to know about that.
Yes, definitely. Most people are not aware that oral health has a deep impact on your overall health. Mm-hmm. And a high percentage of the human population in the world tend to neglect their teeth, tend to neglect their mouth, and it's really not right, because your mouth, your teeth are related to the rest of your body.
You know, as a dentist who has like 24 years of experience, so this is wonderful. You have a lot of information to give to the audience. How often should people brush their teeth?
Well, that is a very common question. Ideally 3 times a day, or every time we eat something, we should floss and brush. But there is consensus on that twice a day. Research from the American Dental Association and the CDC have agreed that twice a day, brushing twice a day, morning and night, and flossing at least once a day will be probably not enough, but good enough to keep your oral health going.
Okay, very good. So that means twice a day is recommended. However, if you brush your teeth after meal, anytime you eat, it's better, right?
It's much better that way. But if you do it twice a day, still okay.
Okay, very good. So is it safe to use a toothbrush with hard bristles?
Definitely not, Dr. Etienne. Okay. It is highly recommended in order to protect your enamel. Your enamel is the outermost layer of each and every tooth in your mouth. In order to protect your enamel, you need to use a soft bristle toothbrush. Mm-hmm. Whenever you go to buy a toothbrush, make sure that the label in the box says soft, not medium or hard. It always should say soft. Soft is better. What happened with the enamel is that if we lose the enamel, it's tissue that it doesn't regenerate.
Oh,
if you lose it, you lose it for good. You lose it for good, and you do not recover your enamel whenever it's lost by the action of abrasion of a hard toothbrush.
So it is very, very important to use a soft bristles.
It is very important.
So, Dr. Alicia, what about mouthwash? Is it safe, or is it beneficial for people to use mouthwash?
Well, mouthwash definitely is highly recommended, and it is safe as long as it is a non-alcohol
Or
mouthwash.
non-alcohol.
Non-alcohol
Okay.
mouthwash, and also, if you don't find a non-alcohol mouthwash, then use a mouthwash that has less than 20% alcohol content. Those in the market that has 20% or less alcohol content. And make sure you read the labels, because we have the tendency to buy products because we see them cute and beautiful on TV commercials, but it's not supposed to be that way. As Seventh-day Adventist Christians, we are supposed to read labels because our bodies are temples of the Holy Spirit.
Yes, indeed. Dr. Alicia, they have a lot of mouthwash in the market today. We have Listerine. Do they have different types? Some that have 20% or less than 20% alcohol, or does Listerine have the same amount of alcohol? They have Half Cope, Half Cope. That's the one I like.
Scope.
So yes. So do they have different level of alcohol, or how does it work?
Yes, most commercial mouthwash have a non-alcohol version. Most of them have out in the market a version that does not contain alcohol. So we should aim for that. Always read the labels. No alcohol or less than 20% alcohol.
Okay, I see. Okay, so there is a problem because sometimes people brush their teeth, they floss, and they floss their teeth, but there is a problem. When somebody is talking to you, the person, you see that the person has a bad odor, a bad breath. So is it common how to prevent things like this?
Yes, well, that is a very good question, Pastor Etienne. Bad breath is preventable in most cases. I would say 65% percentage of bad breath can be prevented by good oral health. The other 40% of bad breath is related to metabolic issues like diabetes, like liver problems, like some types of cancer, some types of digestive system issues. But most of the times, bad breath is caused by neglect, lack of brushing, flossing, etc.
Okay,
or not do, I'm sorry, Pastor
that's
Etienne,
fine,
or
yes.
not brushing or flossing properly, which is the equivalent of not doing it. If we don't floss and brush properly, it's like we are not doing it.
So that means if we don't have a problem, like a medical problem, if we don't have diabetes, or if we don't have cancer or some type of disease, so if we have bad breath, it is a negligence.
Most of the times, yes, it's negligence. Because some people brush their teeth and change the toothbrush often enough. They use mouthwash often, but they don't brush their tongue.
I see.
Brushing
They have
the
to
tongue,
brush the tongue.
Yes,
Okay.
brushing or scraping the tongue is very important, because most of bacteria that cause bad breath are in the tongue, the
see.
posterior part of the tongue. So it is a good idea to get a toothbrush or a scraper to scrape
To clean the tongue.
to clean the tongue at least once a day.
Once a day. Very good. This is important information, Dr. Alicia, for the people. So let me continue. How often? Because some people, they hate going to the dentist. They don't like to go to the dentist at all. So how often? So we should go to the dentist.
Yes, the ideal is to go to the dentist every 6 months for a person that has a good dental hygiene, and also a person that doesn't have any issues of decay or periodontal disease. It is highly recommended to visit a dentist twice a year or every 6 months for x-rays and professional cleanings twice a year. But if the person has a periodontal problem or other issues going on like frequent decay or interdental decay, should go to the dentist as often as necessary.
I see. So if you have a good dental health, it is recommended to go to the dentist twice a year, every 6 months.
That is correct.
But if you're developing some type of problem, so you should go to the dentist more often.
Yes.
Very good.
That
So,
is correct.
Dr. Alicia, I have tons of questions for you because of your experience. So I cannot have you all the time in the studio. So I have to profit the time
Definitely.
today to ask you a lot of questions to benefit our audience, to benefit our people. So what is a cavity?
A cavity is an infectious disease. Most people don't know a cavity is an infectious disease because it is caused by bacteria. In our mouth, we all have bacteria, and if those bacteria, we don't keep them under control by flossing, brushing, and using frequent mouthwash, then those bacteria start acting up, and they, first of all, will lie down in our gums, and then they will go to our enamel, eat up the enamel. A cavity is a hole in your tooth caused by bacteria. That is the definition.
I see. Okay, so that means if we floss regularly, if we brush our teeth regularly, at least twice a day, if we use a good mouthwash, so we can prevent cavity. Is that true?
Definitely. The answer is yes. Cavities are preventable by good oral hygiene.
All right. So I have a good question I want to ask now, because my wife is using it, and what it is, they call it teeth whitening. So I have a problem with that. I don't use it yet, okay? But I know people have good results, and my wife is using it, so I think it's a good thing. So what do you think? Is that safe?
Most of the times it's safe because before using any tooth whitening system, the patient should go to the dentist and be evaluated by your dental professional, and the dental professional will recommend what you have to use.
Okay, so that means it's okay to use it, but before using whitening, so I have teeth whitening, of course, I have to check with my dentist.
Absolutely. You have to check with your dentist because most of those whitening systems are a little bit aggressive. We have to tell the truth. It can potentially cause sensitivity.
Sensitivity.
Generalized sensitivity.
Okay. So that is why it is important to check with the dentist.
It is important
before using it. There is another disease for the dental health, or another disease in dental or in dentistry. So gum disease, what is it exactly?
Gum disease is known as periodontal disease. Periodontal disease is an accumulation of bacteria. Bacteria in your mouth that are not well controlled by flossing, brushing, and using mouthwash. So they tend to accumulate, and they go straight to the gum, and from the gum they will go to the bone. And periodontal disease is the #1 cause of tooth loss in the United States and around the world, and also it will cause bone loss. Bone loss is devastating. Bone that you lose today is bone that you never ever recover.
So gum disease, it's if you again, you can prevent it. According to what you said, you can prevent gum disease by taking care of the teeth, right?
Yes, most of the times gum disease can be prevented by, as we said, oral hygiene.
Okay.
Hygiene.
So if you already have gum disease, so you have to go to the dentist, so they have to do a serious work for you to save your gum and to save your teeth, correct?
Most of the times, yes. Or periodontal disease has different stages. If the patient is lucky enough to get to the doctor in the early stages, with only hygiene, periodontal disease cannot be reversed, but it can be stopped. Bone loss can never be reversed. We can only stop it. But if the periodontal disease has been evolutioning for a long period of time, the patient will need periosurgery. Periosurgery is, it's not that simple, but it's, I will explain. It's, the doctor will go, the periodontal doctor will go with a scalpel, will cut the gums and clean the gums underneath, and put the gums back.
I see. So the good thing is to prevent that.
Yes,
by
definitely.
good hygiene, good oral hygiene.
Good oral hygiene.
Okay. So, Dr. Alicia, I have a last question for you because, as I said, I have to take all I can have from you today. Last question I have, what is a root canal?
Oh, a root canal, it's like, our molars, our teeth in general have nerves inside. A root canal would be the process in which that nerve that is inside your tooth that gives you sensitivity, the nerve is taken away and is replaced by a material we call gutta percha. Gutta percha will replace the nerve. Then we seal it, and most of the times we put a crown on top of that root canal.
Okay, so that demands a lot of work.
Yes, most of the times the root canal is a lot of work. For a molar, sometimes 3 to 4 visits only for the root canal. We're not talking about the crown and the post that is required after the root canal. Only 4 visits for a molar sometimes.
Okay. All right, very good, Dr. Alicia. Thank you very much for all of this dental information. I think the goal to me, the goal to our audience. And once again, my friends, it was a privilege to be with you today to present to you this first episode of Health Focus. As I told you, it is a quarterly health program sponsored by the New Jersey Conference. Today, the topic was oral hygiene. So Dr. Alicia, she gives us a lot of information. So my friends, practice those advice, practice this information, and you can improve your dental health. Once again, my friend, thank you for watching this program, and I hope that this program will be beneficial to you. So may the Lord bless you. And if you want to call me, you want to visit us at the New Jersey Conference, so feel free to come and visit us. May God bless you and see you.